So hello everyone, my name is Haizhou Wang. I'm here to make a presentation of my recent work that's submitted to the EMBC 2020. Okay, so let me share my slides first. Okay, so my work is titled with Statistical Analysis of Inter-Attributes Relationships in Unfractionated Heparin Injection Problems. And I finished this work with my advisor, Dr. Hui Yang, and we're from the Pennsylvania State University. Okay, so UFH is widely used to prevent blood clot. Okay, so here are two places where UFH is widely used. The ICU, where patients need to lie on bed for days that may have some blood clot, and also the surgical operation rooms and some procedures where there will be some cuts for patients. Okay. UFH is very well studied by many researchers, and the goal is to issue the appropriate dose to the patient. Okay, so because if it comes the drug, you don't want both neither underdose nor overdose. Okay, so for underdose of the UFH, of course you will have a blood clot, and for overdose of the UFH, you will cause some bleeding problems. Okay, so both underdose and overdose will cause delayed treatment and thus maybe higher mortalities for some challenging procedures. There are many different attributes that may be related to the UFH in many research works. Okay, so we have 3 vital signs, which is recorded very frequently, and we have maybe tons of lab tests, maybe 30, 20 lab tests, okay, which are not recorded very frequently. So most of the attributes are not directly related to the UFH, as you can imagine, but may have some indirect and nonlinear relationships. Okay, so for example, in practice, in the hospital, clinicians will focus on the APTT, which is activated partial thromboplastin time. Okay, however, in researchers, researchers will focus on heart rate, APTT, white blood cells, hemoglobin, etc. Okay, maybe it's over 30 or 20 attributes. So our study is to find try to identify which attributes are statistically related to the UFH injection, so we can save some attributes. Okay, we can reduce the number of the attributes. So the data we use is MIMIC3 database, which is a very popular database, and we studied 3,459 patients in ICU. And for each patient, we studied for 40 hours after they first admitted to the ICU. So because if it's a database, we need to pre-process the data real quick. Okay, so data pre-processing involves creating time series for attributes and UFH injections. Okay, so on the left side is an example of the data stored in the database. Okay, we have the time, we have the attributes we're interested, and we have the value. Okay, so these are records. And then we're going to make a pivot table out of these records, okay, and kind of sort it by time so that we can just do the time series, okay? So here we have attributes in the columns, okay? And note that we will have some null values right here because of, for example, at some time point, maybe the clinicians record the heart rate, temperature, and UFH injection, but the clinicians fail to record the respiratory rate. Then we will have a null values here. So for the attribute processing, we're going to form time series that has a time interval of an hour, okay? And when we encounter null values in the time series, we're just going to input the null values by sample and hold method. Okay, so here, as you can see, whenever we have an NA value here, we're just going to take the value just in front of the null value. And for the injection processing, we need to identify how many units to inject for next hours. Okay, so instead of identify a value at some time point. These injection values here is actually 400 units for the next hours injected. It's like a long process. Okay. So, so we found that there are two kind of injection method in the database. Okay, the first one is a basal, which is a slow rate injections over the time. Basically, the basal's unit is a unit per hour, and then we have bonus. Okay, so it's a one-time injection with large amount. So basal is like 1 minute ones. That's like the safer way. While we also find there are like quite a few bonus as well. So we want to find, so after we pre-process the data, we want to find the attributes that can satisfy 3 requirements, right? So we want to find the attributes that can respond to the UFH injection, and we want to find the attributes that can respond fast to the UFH injection. Okay, and we also want to ensure the independency between variables. So these are the 3 requirements we are looking for. So for the first requirement, we're going to calculate the correlations and mutual information between time-delayed attributes and injections. For the second requirement, we're just going to find the optimal time delays that can give us the highest mutual information. And the third, we're going to go ahead and calculate the inter-attribute mutual information. So here's the illustration how to calculate the mutual information. Here's the equation. We need to find out the marginal probabilities and the joint probabilities. And the diagram on the right is showing us how to find the marginal probabilities. So for the marginal probabilities here, we're going to just count the number of the data points in this like long bin and divide it by the total number. And for the joint probabilities, we're just going to calculate the number of the data point within this one little square cells and divide it by the total number. Okay, so after we make the calculation, we found that we identify 3 categories. Okay, high relevance, mid relevance, and low relevance. Okay, so we have mutual information with basal and bonus. Okay, so we first calculate the medium of the mutual information with both basal and bonus, and then we classified the attributes to high relevance whenever both mutual information with basal and bonus are above the median. Okay, quite straightforward. And for the second requirement, we're just going to calculate the mutual information. So here, this is just an example. We're going to calculate the mutual information for each attribute for different time delay. Okay, so here we can conclude that these attributes will have an optimal time delay at 3 and 4 because it has the highest mutual information right here. And here's our result. I would say this result is quite trivial because most of the high relevance attributes are responding like quite fast. Okay, it has really small optimal time delay. And for the third requirement, we are just going ahead and calculate the inter-attributes mutual informations, like shown here. We can find most of the attributes are quite independent each other, except for some of these. For example, his hemoglobin and this hemocritin. Well, except for a little. So combining the results from the three analysis previously, we identified 10 attributes that are really good for the UFH related problems. Okay. So thanks a lot. That's it. And I appreciate everyone who are watching my presentation, and thank you very much.